Hey CrossFitters, I'm Dr. Brad Heimer with Koala Sports Medicine, and today we're going to go through our clinic and talk about some of the different services we have to offer for a wide variety of athletes. Randal Setzler, got the last name correct. He's been a patient now for a couple of weeks and having great results, and we'll also go through a treatment with him so you can kind of see exactly what we do in the clinic. This is our therapy suite. The clinic runs about like a training room. Pretty high energy, great atmosphere, patients in and out. Everything we do in here is designed to decrease pain or inflammation. Or if somebody's doing rehab, of course, we can warm them up before they start exercising. Over here are our machines. We do a variety of electrical therapies, ultrasound. We specialize in a wide range of deep tissue work. First thing we're doing with Randal is called electric muscle stimulation, or more specific, Russian stimulation. What we do is take these electrodes, and as we said earlier, he has a TFL injury. We'll place one on the TFL and one into the ITB. There's two other electrodes I've already placed on the glute because we talked a little bit about glute tendonitis being involved as well. And we'll run a little bit of current through it to help the area to relax. Anytime an area is injured, it wants to immediately spasm down and start wrapping around itself, forming scar tissue and adhesions. Running this current through it helps prevent that by making it relax. Also, it helps decrease any of the pain that's going on in the area. On top of that, we'll put some heat on it to help it to relax even more. We'll come over here, we'll start up the machine. I'm going to turn it up very, very slowly. Randal's going to feel a little bit of a tingle, and he takes as much as he can comfortably. He wants it strong but tolerable. Alright. How'd that feel?
That's good.
Good. And we'll pull these electrodes off. Set them aside. And the next thing we'll do is called ultrasound. Put a towel right there. Ultrasound requires a little bit of conducting gel. That's what this stuff is right here. Mostly water. Goes on the affected area. And then this is the ultrasound one. What ultrasound does is actually shoot sound waves deep down into the tissue. Helps break up any scar tissue, adhesions that are in there. It also generates heat when it does that. So it dilates the blood vessels, washing out any garbage that's in there and bringing in a fresh blood supply. Easiest way of putting it, it's a form of deep heat. So you should not feel much on the surface of the skin. When I'm doing this, Randal may feel a slight warmth. That's it. If it's ever over that, he'll tell me because I need to turn it down because you can burn the tissue below if it's up too high. And it's just slow, continuous passes over the affected area. Not the most exciting therapy, but it is very effective.
One day he's going to surprise me and tells me that he sees the baby.
No, this is therapeutic ultrasound, not diagnostic. Now we're going to do a little bit of deep tissue work. So I'm going to use about a dime size of some analgesic cream. Rub that in. And now lotion. What we do here wouldn't be considered massage so much as it would be actually deep tissue work. It's not designed to be the most comfortable thing in the world, but I don't want Randal flying off the table and trying to hit me either. So generally when we go, we just need about a 6 out of 10 on the pain scale. On that edge of intolerable, anything over that, I'm just being mean to it. And here we're just running the hip through a little bit of range of motion. That way I can get some various fibers of the actual glute musculature.
You're filming.
All right, we're all finished up in the therapy suite. Next, we brought Randal back here. He's going to do a little bit of stretching for all the musculature surrounding the hip and even a little bit in the low back. And then we'll also do some stability exercises with him today, whether it's on the wobble foam, wobble board to stimulate all the intrinsic muscles pretty much from your hips down, hopefully taking some of the stress off of the musculature that's injured.
You're rolling.
All right. Randal's all stretched out and done the stability pad. Now we'll come up here and ice it for 10 minutes for some damage control and help keep some of the inflammation down in the area. After that, we will probably do some rock tape on it or kinesio tape to give him some extra support for his next training session.
You're filming.
We just pulled Randal off the ice, and last thing we're going to do is some kinesio tape on the glute area. That way, next time he's training, you'll have a little bit extra support since the tissue is still injured. Kinesio tape is pretty cool stuff. A lot of people see it or even wear it, but they don't really know what it does. It's similar to your classic white athletic tape, as in it supports the area, but it doesn't restrict the range of motion. Plus, the way the fibers of the tape are woven, whenever you contract, it lifts some of the superficial tissue off the musculature and allows for better blood supply in the area. We'll run across the top part of the glute, hit the pelvic brim. Not applying much tension at all. Scratch it in. And then we'll get the bottom part of the glute. And I'm overlapping with the TFL up at the top. And the bottom part there. And we'll also do a strip down the IT band. The glute actually inserts in the hip, but it also forms a tendon or a common fascia known as the IT band that comes all the way down to the knee. As Randal said earlier, he was actually starting to have pain in the knee and even the calf. That's resolved, but we'll still put some tape on there to give the area some support. Not much tension at all, and then all the way up to intersect with those guys. How's that feel?
It's great.
Very nice. Well, that concludes the therapy. Go ahead and face up for me. Last thing we'll do is just distract both of his hips. Go ahead and grab the side of the table. He just relaxes his legs, and this is just a quick stretch for the joint. Anytime the soft tissue is compromised in the area, it can put a little extra stress on the joint. Go ahead and relax. Joints aren't too different from anything else. They can become inflamed and damaged. This is just a little bit of a quick stretch for it. You thrust so you can bypass the musculature and everything else. You do it too slow, you end up just stretching the muscles. That's the treatment, man.
Oh, thank you, brother.
No problem. Let's sit you up.